Understanding eating disorders, anorexia nervosa, bulimia nervosa, binge eating disorder. Causes, signs, symptoms, and treatment. Eating disorders are serious mental health conditions characterized by abnormal eating behaviors and a preoccupation with food, body weight, and shape. The most common eating disorders include anorexia nervosa, bulimia nervosa, and binge eating disorder. These disorders can have severe physical and emotional consequences, but effective treatments are available. Here's a detailed look at their causes, signs, symptoms, and treatment options. Types of eating disorders. 1. Anorexia nervosa, characterized by extreme restriction of food intake, an intense fear of gaining weight, and a distorted body image. Common symptoms: severe weight loss, denial of hunger, and an obsessive focus on thinness. 2. Bulimia nervosa, characterized by recurrent episodes of binge eating followed by compensatory behaviors such as vomiting, excessive exercise, or laxative use. Common symptoms: episodes of overeating, self-induced vomiting, and feelings of guilt or shame. 3. Binge eating disorder, characterized by frequent episodes of consuming large quantities of food without compensatory behaviors. Common symptoms: eating large amounts of food rapidly, eating in secret, and feeling out of control during binges. Causes of eating disorders. 1. Genetic factors. Family history. A higher risk of developing eating disorders if there is a family history of these conditions. Genetic predisposition. Genetic influences on body weight regulation and psychological traits. 2. Biological factors. Neurobiological factors. Imbalances in neurotransmitters and hormones that regulate hunger and mood. Body image perception. Brain regions involved in body image perception and reward processing. 3. Psychological factors. Perfectionism. High levels of perfectionism and unrealistic standards for oneself. Low self-esteem, negative self-image, and low self-worth. Cognitive distortions. Distorted thinking patterns related to food, body shape, and weight. 4. Sociocultural factors. Cultural pressure. Societal emphasis on thinness and unrealistic body ideals. Media influence. Exposure to media promoting thinness or muscularity as ideal body types. 5. Environmental factors. Traumatic experiences. Trauma, abuse, or significant life stressors. Family dynamics. Family attitudes towards food, weight, and dieting. Signs and symptoms. 1. Anorexia nervosa. Physical symptoms: severe weight loss, emaciation, thinning hair, brittle nails, dry skin, and amenorrhea, loss of menstrual periods. Behavioral symptoms: excessive exercise, food restriction, obsession with calories and dieting, and social withdrawal. Emotional symptoms: intense fear of gaining weight, denial of the seriousness of low body weight, and distorted body image. 2. Bulimia nervosa. Physical symptoms: swollen salivary glands, sore throat, dental erosion, and gastrointestinal issues. Behavioral symptoms: binge eating followed by compensatory behaviors such as vomiting or misuse of laxatives, secrecy around eating. Emotional symptoms: feelings of shame, guilt, and distress after binge eating episodes. 3. Binge eating disorder. Physical symptoms: weight gain, obesity, and associated health issues such as hypertension and diabetes. Behavioral symptoms: eating large amounts of food rapidly and in secret, eating even when not hungry. Emotional symptoms: feelings of shame, guilt, and distress about eating behaviors. Treatment. 1. Psychotherapy. Cognitive behavioral therapy, CBT, focuses on changing unhealthy eating behaviors and distorted thinking patterns. Interpersonal therapy, IPT, addresses interpersonal issues that may contribute to eating disorder behaviors. Dialectical behavior therapy, DBT, helps manage emotions and develop healthier coping strategies. 2. Nutritional counseling, dietary guidance, education on healthy eating habits and meal planning. Nutritional rehabilitation, restoring healthy eating patterns and addressing nutritional deficiencies. 3. Medication, antidepressants, selective serotonin reuptake inhibitors, SSRIs, like fluoxetine, Prozac, for treating bulimia nervosa. Appetite suppressants, Medications for managing binge eating disorder, such as lisdexamfetamine, Vyvanse. Mood stabilizers, medications for managing co-occurring mood disorders. 4. Medical monitoring, regular checkups, monitoring of physical health, including weight, vitals, and potential complications. Hospitalization. In severe cases, inpatient treatment may be necessary for medical stabilization. 5. Family-based therapy, family involvement, involving family members in therapy to support the individual's recovery. Family education, educating family members about the eating disorder and how to support recovery. 6. Support groups, peer support. Groups for sharing experiences and coping strategies with others facing similar challenges. Online communities, virtual support networks for additional support and information. 7. Self-care strategies, healthy routines, establishing regular eating and exercise habits. Stress management, techniques such as mindfulness, meditation, and relaxation exercises. Body positivity, promoting a healthy body image and self-acceptance. 8. Alternative therapies, art and music therapy, expressive therapies to explore emotions and experiences related to the eating disorder. Mindfulness-based therapies, practices that enhance awareness and acceptance of thoughts and feelings without judgment. Eating disorders such as anorexia nervosa, bulimia nervosa, and binge eating disorder are complex conditions with serious health implications. Understanding their causes, recognizing the signs and symptoms, and exploring effective treatment options are essential steps in managing these disorders. Early intervention, comprehensive treatment plans, and ongoing support are crucial for recovery and improving quality of life for those affected by eating disorders.